here's what you should do depending on where you are in your hair loss journey. So, I mean, we both see patients that come in at all degrees of hair loss, from like super early, you basically have no hair loss, but you looked at your dad and your brother and you said, hey, I'm gonna have that, so you're super nervous.
What can I do? Yeah.
And so that's probably in the kind of like prevention category, stage 1. And then you have the other end of the spectrum where, let's call it stage 4, where you've got significant advanced hair loss and really no amount of non-surgical therapies are gonna help. Surgery is your best option. So, you know, we see everything in between. I guess from my perspective, if somebody comes in with really early hair loss or, you know, kind of preventative goals, we talk about all the non-surgical stuff, you know, oral medications, topical solutions, PRP, laser cap, those are kind of our go-to non-surgical recommendations. What about you? Like, what would you say for someone who's kind of stage 1, let's call it?
I mean, yeah, so it depends, honestly, if I'm dealing with a man or a woman, only because for men, I'm not going to say treating hair loss for men is less complicated, but you know, for men, hair loss is,
I think it is.
It's a dominant trait, meaning men are particularly sensitive to inheriting hair loss or patterned hair loss. For women, it's a little bit more complicated. The pattern evolves differently. It's more diffuse. So a few women will actually go completely bald. I don't like to use the B word, but bald on the top of their head. So more therapies can be applied early on. And then, of course, hair loss is relative. So how somebody feels about their hair is different, because, you know, I may see them or do a consult and I look at them and I'm going, oh my gosh, they need hair replacement, they need a transplant, but they're not ready. They're not emotionally ready. As far as they're concerned, they have a few hairs on their head and they want to do everything they can to keep that hair growing and keep it healthy and strong. So psychologically, they need to be in that stage 1 or 2 or 3 before they evolve into the next stage. So from my perspective, that's what I see. I would love to say we could throw people into categories, but there's a little bit more nuance to that. And I think a discussion has to be had, a consultation, some kind of to see what they want. What are your goals? What do you want to see for your hair? And when do you want to see it? And start from there and kind of work backwards. Yeah.
So I'm pretty sure that's not what Jason wants to hear.
Yeah, sorry. Sorry, Jason.
Yeah, sorry, Jason.
She did talk about the stages, and she just tacked on a lot of good information that related back to it.
Yeah, okay.
You'd like to put, because the fact is, you know, you'd like to put people, oh yeah, you've got this hair, but...
Well, the issue is like when they come to the consult, it's like for us to be able to, I'm assuming, he hasn't said this to me, but I know how he thinks by now. So it's going to be like, it'll be a way for us to streamline the consult process, I think. Yeah. To kind of know where they fit. But you're right,
trichology is kind of like a gateway to, like, I see these people all the time. Their hair's not going to grow very much. No matter, I can't give them, I can put Miracle Grow on their hair, but it's not going to work. But they're not there yet. And it's not going to take years. Every time they come in for a follow-up, that comes up like, what do you want to see? Well, I want to see this guy, or I want to see this girl. Okay, so your scalp's healthy. We got you on this protocol. You've seen for yourself what's possible. Now it's ready. You're ready to transition. And not everybody's like that. But
well, maybe we could kind of answer it as like, okay, if they're like really early, stage 1, and I don't know what you would say. Like if somebody came, I'm not a good example. If like a 20-year-old came in with perfect hair and they're like, I'm worried about my hair loss, what would you just tell them to leave, or would you be like, no, everybody, there's give them some sort of scalp massage therapy or something, right?
Always. I mean, if everybody, doesn't matter if they have a full head of hair, misunderstands how they should treat their scalp and their hair in general. So
it's like education.
Exactly. Scalp care is the new skincare.
Yeah.
You know, so I am this bridge between dermatology and cosmetology. So in the very least, I'm going to tell you how to take care of your hair and take care of your scalp in the way an esthetician would tell you to take care of your skin. Right. And there's no turning away. Everybody.
Yeah. And so for me, like from my side of things, if somebody came in with perfect hair, I would be like, go see Caroline. I've got nothing to offer you, basically.
Yeah.
At stage 4, again, if we're going to give it that category. So at stage 4, if you've got significant hair loss, then I'd say surgery is your best bet. You got to do the non-surgical stuff to keep what you've got and maybe stimulate some new hair growth. And again, that's, you know, oral medications by prescription, topical solutions, PRP, laser cap, but probably surgery is your best bet. And I think you'd probably say the same.
Yep.
In the middle, where you've got like you got some hair loss. Probably you could benefit maybe from a small surgical procedure, and you would benefit from some of the non-surgical stuff. Like what, I don't know, what would you tell those people in that in-between stage? Is there specific stuff you'd recommend?
I think in that in-between stage, again, we're so quick to, and the trichology professionals have the same problem as medical professionals, where the more you know, you're kind of quick to where would we box them? Where would we box them?
Yeah.
But the truth is, we have to bring it back to them and find out where they want to be.
Right.
So, and that doesn't have to be, that could be a questionnaire.
Yeah.
That could be a questionnaire that you have online. That could be a consultation.
Yeah.
But if their expectations are to have a full head of hair within a year, trichology is not going to give them that. So
Yeah.
if they're somewhere in the middle, I always like to say, scalp care is the new skin care.
Right.
We will definitely put you on some kind of scalp care system and sort of guide you through the next steps. And maybe a surgery is in your future, but if it's not an advanced stage of hair loss, then hopefully we can maintain what you have until you're ready to have that conversation with the surgeon.